I had 3 open fractures on my right arm, and then my face was broken. My jaw was broken from my tooth where, my tooth line up to my eyeball blew out my orbital floor, and then I had a broken left foot.
Michael Ribordy was left shattered and broken after a devastating plane crash. Coming up, how his team of doctors at the University of Kansas Health System put Michael back together again. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. It's a remarkable story of survival, one that starts with a passion for flying and ends with a second chance at life. We'll get to that story here in just a moment, but first, we start with our morning rounds today and news in the world of cellular therapeutics. In a matter of weeks, the FDA could greenlight a trial that would bring CAR T cell therapy to the patient. Patients who simply do not have access to this type of treatment because of where they live. We are joined now by Dr. Joseph McGuirk, Director of Hematologic Malignancies and Cellular Therapeutics at the University of Kansas Cancer Center. Good morning, how are you?
Good morning, Jess. Very well.
Good to see you. So, Dr. McGuirk, explain what this trial could pave the way for.
You bet, absolutely. Just as you know, over the last several years, we've been on the forefront at University of Kansas Health System in terms of employing new types of immunotherapy using cells from patients' own immune system, re-engineering them genetically in the laboratory and reinfusing them in curing previously incurable blood cancers, lymphomas, multiple myeloma, acute leukemia, etc. It's been a breakthrough. However, we also have an upcoming publication in the medical literature that shows that the overwhelming majority of patients who might receive this therapy and be cured by it do not have access. So only about 10 to 20% of patients.
Well, yeah, because I wanted to talk to the numbers, this alarming percentage of people who might benefit drastically from CAR T therapy, but they don't even know about it, Dr. McGuirk.
That's right, absolutely. And there are barriers to access. We live in an area where ranchers live maybe 5, 6, 7 hours from here. It's a major logistical challenge for them to come here. And then there are socioeconomic issues. People may not be able to come to our center from hours away because it's either the gas to get into Kansas City and the local lodging or paying the electric bill and putting groceries on the table. And so we have a strategy that we've been developing, a national protocol, which University of Kansas Health System is leading, whereby we're making CAR T cells from normal healthy donors that may have certain advantages, including improving access by being able to take them safely out into community hospitals and administer them where people live rather than having to come into the city.
So you mentioned this access to healthcare being a huge barrier for patients who might benefit from the treatment once it's approved, but what specific role would the Cancer Center play in helping to bridge this gap with what they hope to gather from the study?
Well, we'll be using cells, as I mentioned, in young, partially matched for their immune system donors, and those cells can be made for 500 patients from a single 18-year-old college student who donates their blood, and then they're ready off the shelf. Currently, it takes a month and a half to make these cells. Some patients progress and die in the process of waiting, and these cells are readily available. We can get them in 24 hours. They also appear to have effectiveness that may be similar to that we're seeing with commercially available products, and hopefully even better, with a very good toxicity profile. And these data were presented at national and international meetings recently. And so the safety profile lends itself to our ability to take these out in a timely manner to improve access for patients who are not receiving this therapy today. Only 10 to 20% of patients who might benefit and be cured by these therapies are actually receiving them in the United States, and that's not acceptable.
It isn't. And to put into perspective how impactful CAR T cell advancements have been, one of our patients, Katie Kopp, was the first in the country to receive CAR T cell therapy enhanced with CRISPR gene editing, part of a clinical trial to seek an advanced treatment that reprograms a patient's own immune cells to recognize and destroy the cancer. And Dr. McGuirk, I have to ask you, how's Katie doing today?
Katie's more than 5 years out. She had an incurable cancer, a very large tumor in her abdomen. It melted away with the CAR T cell therapy. As you mentioned, not only is she the first person in the nation to receive this therapy. She's the first person in the world to receive this specific therapy. We just published that in a leading medical journal this past week on a large group of patients, 34 patients. Katie was the first, and she's back to work, back enjoying her family, and out in the world. This is really a remarkable game changer and a paradigm shift in our field.
Incredible work you all are doing, Dr. McGuirk. Thank you so much. So much more to come on this, I know, in the future. We always thank you for your expertise and being with us today.
Thank you.
At 29, Mike Ribordy was in a plane crash that left him with devastating injuries, from multiple fractures and significant trauma to his face. This morning, we walk through his recovery, the complex surgeries that saved him, and what comes next. 29-year-old Mike Ribordy has been flying planes for nearly a decade.
I really liked the fact that I could just jump in an airplane and be somewhere that would take hours to drive.
But that love of being in the air nearly cost him everything.
Day started out pretty normal. One of my buddies texted me and said, "Hey, let's go flying." I said, "All right, where to?"
Mike hopped into his plane and headed off on a short trip to Parsons, Kansas.
It was a little overcast that day, but the weather cleared up, and all I remember was texting him saying, "Hey, I'll meet you down there."
As Mike's memory faded out, his friends were waiting on the ground as he was coming in. It's something they'll never forget.
From their story, I was coming in to land there at an airstrip there in Parsons and clipped some power lines with my left wing and just nose dove to the ground and did a lot of damage, totaled the airplane. I remember my airplane was flipped upside down. They had to lift the airplane up. There was 4 of them there. They had to lift it up by hand and be able to pull me out.
Mike was taken to a local hospital, but right away transferred by ambulance to the University of Kansas Health System, a level 1 trauma center.
I remember waking up in the hospital after that.
It took a specialized team of experts to help put Mike back together.
I had 3 open fractures on my right arm, and then my face was broken. My jaw was broken from my tooth line up to my eyeball, blew out my orbital floor, and then I had a broken left foot.
Mike spent about a month recovering in the hospital, so his friends helped break the news about his plane.
And he said, "Mikey, you wrecked your airplane." And I said, "What an idiot," because, you know, it just wasn't obviously the greatest thing you could have done at that moment. And but they all laughed. I try to say I have a sense of humor, and I was taking it pretty lighthearted because I was just happy to be alive. I knew after that I was like, man, I'm going to make it. I was in pretty bad shape, but I was like, man, I'm in the right place for sure.
Next, it was 8 months of rehab and physical therapy before Mike felt whole again.
Free and clear.
Mike and his wife, Gabrielle, had just had a baby at the time of the accident, and they recently had another. She knows she can't keep him on the ground for long, but Mike says he promises to be more careful.
My motto is check yourself before you wreck yourself. And literally, I wrecked myself because I was getting too comfortable in what I was doing instead of doing my routine check of, you know, checklists are huge, especially in flying. But I mean, really anything in life is like, hey, did I check this before I commit to something? Something as simple as not checking for power lines, man, really altered my life forever.
Mike is grateful for his care and back to what he loves and getting closer to flying solo again.
Oh man, I think it's gonna feel like a bald eagle, man, just flying around, just not a care in the world.
Studio is an understatement. How are you?
I'm great, man. I'm great.
Well, you're looking good, and we're so glad that you're here to share your story with us. Also joining us are Mike's surgeons, plastic surgeon, Dr. Michael Lipka, and Dr. Matt Drake was Michael's orthopedic hand surgeon. Guys, thanks for being here with us. How nice is it to be sitting here on either side of this man today?
Awesome. Yeah.
Very rewarding.
Yeah.
Very rewarding. Well, Mike, I want to start with you. Your interest in flying goes back quite a way. You are not a novice. You've been doing this for quite a while. How long have you been flying?
Oh, I've been flying since about 2014.
So take us back to that day. You said it was a pretty typical flying day. You just hop in the plane and go.
Yeah.
It turned out to be anything but a typical day. What do you remember just before the accident?
I was out in the hangar working on my airplane, just kind of looking at the weather and just washing some bugs off. And I remember my friend texted me saying, hey, we're going to go meet down at a friend's house. And I was like, okay, I'm down. So that's really all I remember. that's it.
That's the last thing you
Yeah.
remember. And then the next thing you remember, you woke up in the hospital, again, with no memory of what had happened. What was it like the moment that you realized what had happened?
I was like, man, me? You know, it was like, you go through that situation, you think, this will never happen to me. And then when it happens to you, you're like, just surprised. I was just glad I was in, well, I say one piece, but I was there, you know, I was there, I was alive talking, and that's really what was going through my head.
And you
It was
said
like,
all
man,
your friends were surrounding you,
yes,
there to kind of relay the story.
yes.
So Dr. Lipka, we have images of the fractures below his eye. We want to warn our viewers first that these are a little bit graphic, so if you're squeamish, maybe turn away for just a moment, but kind of explain to us what these facial injuries were and what you were dealing with.
So he had a fracture of the right side of his face, the cheekbone, it extended into the teeth, and then within the orbit, the floor of the eye socket and one of the inside walls of the socket was fractured. So if you don't fix that, the eyeball can tend to want to drop back in the orbit. It can result in some motility problems of the eye, so that's the importance of fixing it. With respect to the tooth, the fracture going into the teeth, you know, if your bite feels off, that's a problem. So we're trying to restore form and function, basically.
I have to ask you, when you hear that someone took a nosedive in their airplane and they're being transported here to the health system, what's going through your mind as far as preparing for what you're about to deal with?
Well, you know, the acute part of that, the trauma surgeons here, are the ones who are looking after the life-saving injuries, and these are more injuries that are dealt with afterwards. So we evaluate and figure out what we're going to do. So we have more time in this setting.
Dr. Drake, 3 open fractures in one arm. You're specialized in as a hand surgeon. How do you work together with the other orthopedic surgeons when you have injuries in arms and hands and who knows where else?
Sure, we have a very collaborative team, and everyone kind of chips in where you know, their skill set is the strongest. And so we work together to come up with a good plan and timing and try to get the best outcome.
Well, we have video of the plane crash that we want to show. Dr. Drake, when you see a trauma like that, what other injuries would a surgeon be looking for right away? What might you anticipate happening?
Well, the hardest thing for orthopedic surgeons is we'll see some obvious injury, and it's very easy to focus on that and then miss other things that may be even bigger deal, you know, so a head injury or abdominal injury or things like that. So we really do rely on a full team to make sure we don't miss something critical.
Yeah, so I guess it's like kind of a full body check. You got to find
Sure.
out what's going on the outside and on the inside.
And multiple times over the course of a few days to make sure.
Exactly. Mike, what else were you dealing with beyond the arm and facial injuries?
I just, like I said, just had my son. He's 3 months old, so we were really busy at home. My wife was obviously thrown into a panic because obviously I'm out of commission. So just dealing with raising a 3-month-old, and basically he lived in the hospital for about a month with my wife. My wife stayed up here the whole time. So
I wish she was here so I could ask her, but what was going on with her? How was she handling this news? Again, you guys are a young family, and you had another one coming?
that was after the fact.
Yeah, you have another one now, but
Yep.
yeah, that's a lot for a young mom to deal with.
Yeah, we had a great support system with family, friends, so that really helped take the stress off. Not the stress wasn't gone, but it was still there. But just how are we going to get through this? How are we going to get through this together? You know, in sickness and in health, we took that to the extreme in this case. But we you know, prayed through it and God brought us through it, and that's where we're at.
Sure did. Dr. Lipka, I want to talk a little bit more in depth about the complication of the facial fractures and what is it like to repair? I mean, that's a big job for you. Somebody brings their face to you and you're here to help put it back together. How complicated is it to do that?
Well, sometimes it's complicated. We're trying to hide incisions and natural creases of the face for access to the fractures. And with respect to Michael's fracture in the orbit, you know, the eyeball's there, that's what you see with, so that's very important to protect that. So we're trying to repair the walls of the orbit but not damage the eyeball itself. So
what are we
it can
seeing
be challenging.
here?
So that's inside the mouth. You see there's a fracture extending down into his upper jaw. We've accessed his fractures from above there in that photo, fixing his cheekbone.
And those are like staples or?
Yeah, so those are titanium alloy plates and screws to fixate everything in position. And within the orbit, the walls are very thin, so we can't just put those back together. We have to replace them, so we use an implant in that situation.
I'm looking at Mike's face, and it's hard to tell anything's wrong with it. If you take a one shot of Mike, I mean, it's hard to tell. I mean, this is not your typical, I've been in a nosedive plane accident.
Yeah, that's, I mean, he's a good result, definitely. We've got the bone, if you can get the bones back in position and reconstruct what was there before, usually people have a good outcome. So.
Go into depth a little bit more on how you handled his hand injuries.
Sure. He had a really high energy impact to his arm, enough to break his humerus bone and both bones in his forearm, as well as dislocate some joints in his hand, and all of them were high enough energy that they all came through the skin.
Can you show us, because I was asking you about that. Tell me about what you said you were finally able to do. This is a very important move for any parent.
Yes. So I remember, I didn't have any use of my arm, very, very limited mobility. And one day we were driving, and my son, we had just stopped and got some fast food, and my son was wanting a fry, so I was able to reach back behind me in the car seat, and I freaked out. I was like, "Babe, look, I'm able to give him a fry." She's like, "What?" I was like, "Look, my arm is moving."
You're healed.
Yeah.
You're healed.
And she's like, "Okay, yeah."
See, it's those tasks. That is a very important dad task for sure. Well, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. Again, we mentioned you had a 3-month-old baby boy at the time that this happened. You have another one now. How much did that drive your recovery motivation?
Oh, it was extremely elevated, my drive. I was very immobile when I got home, just sitting on the couch. My wife was, taking care of me, and I was like, this is not how it should be. So just knowing the fact that my wife was doing everything, bless her heart, she was running, with a 3-month-old, trying to get me nursed back to health. And I was like, I gotta get better as soon as possible. So my drive to complete physical therapy and, have a diet that supported the bone growth, and that was really a huge factor in my recovery.
At what point did you realize, just mentally, I'm gonna recover from this, I'm gonna be okay?
When I saw the community around me come together, and my family just able to support me, and when I was down, because I was at my lowest, and I just saw that everyone, that trauma was able to bring people together. I was like, I'm going to be okay. I'm not alone. I have a great team of doctors. I have a great family, friends around me. That really drove home I was going to be okay.
Dr. Lipka, I want to talk long term, because you have an orbital and jaw fractures. What are you watching for as he continues to heal, or is he done?
Well, right now I think we're in good shape, but right after the surgery, when you operate on the eye, a lot of people, and Michael also, and when he has a lot of swelling within the orbit, he had some double vision after the surgery, and that typically gets better with time, and that's something we're watching for, vision and how he sees. That's the most important thing. And his double vision slowly resolved and got better. His bite as well, I know he's had some other dental work because he had some dental injuries. So these are very functional things that we're worried about long term.
Dr. Drake, same question. What does a recovery look like after this type of hand and arm trauma?
Once the fractures are healed and he's finished therapy, there's usually not much further to worry about or keep an eye on.
You were back to basketball, right? Did you say you were playing basketball just a few months later?
Yeah.
How many months later?
Probably 3-4 months after.
You're right-handed, take
Yep.
it?
I am right-handed,
Okay,
yeah.
there you go.
Yeah, temporarily left-handed, but we're making a comeback with the right hand.
I bet. So when were you able to get back to flying?
I was back in an airplane 3 months after the accident, and my friend let me sit in the cockpit and take his airplane up, and it was scary at first, and then I was like, it was like put on an old shoe. It felt great, and I was like, I got to continue doing this. I told myself, if I don't get back in an airplane now, I probably won't ever. So that was a drive for me to keep on doing what I have a passion about and love.
And was your family, wife, okay with all this?
My wife was sitting out there. I'm sure she was nervous, but she says, I love seeing you do what you love.
Yeah, that's right. And Dr. Drake, what has to happen medically for someone to be able to be cleared to fly again solo? Because you're flying with somebody right now, and then soon you'll be able to go at it alone again. What has to happen?
It's complicated. I mean, he has to have a full physical recovery and also mental and cognitive. There's a lot that goes into it. It's very difficult, and I think he's still working with the FAA on that.
Yeah, what is that process? What do you have to do through the FAA?
So they basically send me a list of things that they're checking out, after the accident, they're concerned about, cognitive function, function with your extremities, making sure you can control that aircraft in a safe manner, and that means going to follow-up appointments, going to see specialists. I've seen neurologist, pulmonologist, orthopedic, and just whatever they want to send my way.
Well, you said check yourself before you wreck yourself,
That's right.
right?
That's right. So just going through all the checks, make sure everything checks out, and then I'll hopefully get that medical clearance.
So, Mike, when you see these pictures of the crash, the hospital, we've been showing photos of your family, your wife, how has this accident changed you?
Before the accident, I had that mindset of I'm invincible. I'm kind of, nothing can happen to me. And afterward, I was like, man, it can happen to anybody. And I'm just very thankful. And I'm going to live life to the fullest, because life is unexpected a lot of times, so you never know what's going to happen. So I live every day to the fullest, and this has definitely changed that mindset.
How do you feel physically now compared to before the crash? Do you feel the same? A little different?
A little different. Little draggy in the morning, but I expected a lot of pain afterwards. But I don't even take Tylenol on a daily, and that blew me away. I was like, I thought for sure I'd have a Tylenol bottle in my pocket for the rest of my life, and I have no joint pain. I'm full range of motion in my arm, and that's just incredible.
Dr. Lipka, do you attribute that to age, someone's ability to be able to bounce back in that way?
I think so. He's young and a healthy guy for sure. Yeah.
And he's doing all the right things.
Yeah.
So I want to ask you, we mentioned the mental aspect of it, not just getting through the injuries, but then looking at these images of this crash. There's so much mentally going on. How did you manage that, and what advice might you have for other people going through something similar?
I have a really good outlook on life. I think I just, I see that situation, and you can either, my mind says you can either be bitter or be better. If you're not, if you're living in the past all the time, you can't make yourself better. So like I said, it happened, but the worst is either I was dead or I'm making the most of I'm alive. So that I just embrace that as like, I could, you see a lot of people in accidents that, it really affects their mental health, and they're always depressed. And I was like, I'm going to be the opposite. I'm going to not make that happen. And I was like, told my friends, my family, you guys got to help me, because it was a struggle at first. I wasn't always, when I got home and I was just sitting there, it was tough. I had to make a decision every day. I'm going to be better because of this.
Well, let's get to some questions from our viewers this morning. Eric has one. He's curious how many surgeries that Mike had and over what period of time.
We counted 12 surgeries, 12 total surgeries.
Is that pretty typical?
It's pretty average for a high energy trauma like this.
Question from Beth. Beth asked, what are the biggest risks after a high impact accident like this crash that you see here?
Well, I guess more major internal injuries, life-threatening injuries. The bone fractures and stuff, that can be dealt with later, but and the trauma surgeons are the ones who deal with that and evaluate that when you first come in. So,
Becca wants to know if you got another plane.
I did get another plane.
You did? Okay.
Yes.
And Jean wants to know, how could this accident have been prevented?
Like I said, if I normally when you come into an airport or this was a grass strip in this case, you overfly the field to check for obstacles. And since I hadn't flown for a couple of weeks and I was with my friends, I was like, I'm just gonna go straight in. Didn't do a check, and complacency, it'll get you when you least expect it.
And certainly that's changed your perspective on
Yes.
flying. Tim wants to know how panicked your friends were and how long was it before they were able to get you out from underneath that plane?
They were. I had a friend. He was immediate action. As soon as I impacted the ground, he was running over to see where I was at and lifting the plane up. And I was extremely thankful for the guys that were there. They jumped into action immediately.
Oh, I bet their adrenaline kicked in big time when they saw that. Question for Dr. Lipka from Angie, wanting to know, in terms of facial traumas, where does Michael's injuries rank in what you've seen in your career?
His were pretty bad, but we see things that are much worse where all the bones of the face are broken. So probably somewhere in the middle.
Casey has a question. How long does it take bones to fully heal after a major trauma?
Depends on the bone, but generally 4 to 8 weeks or so. Sometimes they don't heal.
All right, we've got some more questions coming in. Let me see. I don't see those. Tina is asking what the other picture that we had, was that inside his mouth? And what was the other one? I think this one.
So that's from above, sort of peeling the scalp down to get access to the upper orbit, and that's from inside the mouth. So those are fairly typical incisions to get access to fractures of the upper face and upper jaw.
Dr. Lickfoot, what's the big takeaway from this story today?
Well, we have a great team here to look after patients like Michael, and it takes a collaborative effort to get a great outcome like this.
Dr. Drake, what do you want people to really take away from Mike's story?
I think he's a very special person. You can tell how resilient he is, and that impacted his outcome as much as all the work we did for him.
Mike, what do you want people watching and listening to really get from you today?
I want people to know that University of Kansas is far they're far versed in what they do, and then if you guys follow what they have to say, you know, diet-wise, exercise-wise, PE, you know, physical therapy, you've got a really good chance of coming through. I was a pretty bad case, but like I said, I told myself I'm going to listen exactly what they have, go through what exactly they want me to do, and I feel like I'm going to have the best outcome, and it proved great.
It did. You look great. I said when I walked in this morning, I said, oh, Dr. Drake, we were like, here's a familiar face. I said, oh, you're a new face in here, and you said, literally.
Yeah, literally new face.
Literally a new face inside our studio. So we appreciate you sharing today. We're just glad you're back.
Yeah, me too.
Glad you're
Glad
back.
to be here.
Yeah, good. Well, we want to thank all of our guests for being with us today, and thanks to our viewers for joining us. We'll see you back here on Monday. And coming up on Monday, Kyle Mead is surviving and thriving after a diagnosis so rare that doctors are now using his case as the example.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.